Hi everybody, coming up in today's video we got this really narrow canal with some super sticky tacky wax as well. There's actually 3 patients in this compilation. One of them's actually really short, but I think that was Taylor's one a bit later on. So you can see we're just clearing the entrance to the canal, and you can already tell that this wax is super sticky. It's really wanting to stick to the side of the canal wall. Now in a more open canal, so something with maybe just a little bit more room in there, the tacky wax doesn't really cause too much of an issue. But when the canal is smaller, like this one is, it really does cause a lot of problems because it naturally wants to stick to any surface, including other bits of wax. So if you've got a piece that's stuck to the one side and the other side, and then you get a little bit in the middle, that's it. It really blocks up. So we can see we're lifting this little piece of wax off the base of the canal. Oh, guys, I owe you guys an apology as well. I apologize for swearing in the last video I put up. Oh my, I was just so frustrated recounting that story about that particular patient. Love him. And yeah, it just got to me a little bit. I apologize because it's not very professional of me to swear on a video. I shouldn't really do it. But I just got a bit carried away because it was just so frustrating. I'm still frustrated now. But anyway, back to this one. So what we can see is we're just peeling down the canal. So we've got almost this dry skin layer with this really sticky, tacky wax on top of it. You can see the discoloration to the canal wall. See how that's a little bit pinker, all the blood vessels coming to the surface there as well. Just trying to get a grip on an edge here. Trying as best I can to maneuver this down. But as we're trying to walk this plug down the canal, what's happening is it's adhering to the canal walls on both sides. So I'm having to sort of almost really gently bring it down from the surface, almost roll it to a certain degree, just to bring it to this entrance. There we go. We could put a little bit of olive oil in here, and that would certainly help to move it along the canal wall. But when the canals are very narrow like this one is, it usually tends to cause more problems because you lose some of your visual. So it does tend to become a little bit harder here. But back in now with a standard size Zoellner tube. You can see that the surface is moving when you're holding onto it, but that whole plug is not really budging. So it's only just moving that very outer surface wax there. See how that top section, like I'm pulling down from the top and I'm lifting from the bottom, but that top section is really firmly adhered to the canal wall. But now we've got a little bit of movement. This is more like it. Just broke the front end off there. It's got that conker-brown colour, that darker, thicker, like clay type wax, this one. So I'm going back in. I was trying to see if there was enough suction grip left just to pull that last bit. A little bit that was on the end blocking the suction tube, that just got sucked into the machine. But you can see that harder section there. There we go. Now we can see the eardrum. So patient is, at this point, hearing much better. But there's just a couple of little loose bits now just to tidy up. So I'm just working around the outside edge. We've got the one bit that was jutting off the side of the canal wall there. There we go. Good bit of tidying up. Lots of dry skin there on the outer portion of the ear canal. But let's take a look at that eardrum. Looking really healthy there. Really good. So this is the second ear canal here. Oh, the other ear canal. I keep getting told off, right? I keep saying the other or second. I think everyone was telling me off because everyone only has 2 ear canals. I can't remember. I end up referring to it now, but anyway, the other side. So we're just lifting off the base of the canal. The reason this wax is gone as sticky as it has, as you saw it in the last ear canal there, where these little tiny white lifts of dry sort of keratinous skin, and that's what causes this to dry out. It's not absorbing as much oil, so we end up with this really dry, thick, sticky type of earwax here. So let's pull down from the top. There we go. Oh, it's nearly there. You can see it's edging its way towards the outer portion of the ear canal. And out that comes. There we are. Lovely plug, that one. Came away a little bit easier than the other side. You can see a little bit of remnants here, top, bottom. So we're just going to go back in for a little quick tidy up. There we are. Take that little bit of dry skin from the outer section of the ear canal there. Let's go in then, take a look at this section at the top. Let's pull that away. Let's get in there. There we go. And out that section. That came away a lot cleaner than I thought it would. I thought we were going to struggle with that top section there. And there's just a little bit just here. Now this is right on the canal wall. So I'm going to try and lift, but try not to touch the canal wall at the same time. It's a little bit more difficult to do this bit. There's a little piece of dry skin there. Good, let's take a look at that eardrum. Nice and healthy, good light reflex there as well. So we've got just under 1.5 centimeters, half an inch worth of wax on that one. So this is one of Taylor's patients here. Now we stopped on this particular image at the front here. Now this is how the patient first presented to us back about a week or so ago. And you can see very wet, classic signs of ear infection, that one. Patient's gone away and been treated with antibiotics for about a week to 10 days and now returned because they're still feeling a little bit blocked up. So what you can see Taylor doing here, it's quite a sort of an oval shaped ear canal. It's quite narrow on the sides, but this is actually a fine end. So you can see just how tiny this little ear canal is. Now, a lot of the times, if patients have been treated for an ear infection, sometimes what you get, especially a discharging one, you'll get this very, very fine kind of hardened up, what's basically this dried infection. And now take a look at this. You can see when you punch through that kind of surface layer, look how wet that still is behind there as well. So you can see that infection there. And this is what happens a lot, is you get this kind of surface layer that hardens and that kind of traps everything in, which is making the patient feel really blocked up. So this is actually this is a Rai Curette, I'm so sorry, on this particular patient that Taylor's using here. Quite a difficult one. You can see it's very, very narrow in there. Just clipping this front end off. So our advice to this patient would be, I would be saying go back to your GP, just get them to take another look in there because that still doesn't look particularly healthy. There we go, fine end on here. You can see how wet that discharge is back there as well. So he's just lifting from that base section. Very tough one to do because he's got to peel the canal walls here, but when he's peeling away, he doesn't have a tremendous amount of room. So what we've got is he's taken it, that sort of peel from one side to the other, but he's almost instantly getting to the opposing canal wall. So now he's trying to go up the center, which is going to give us a little bit more room top to bottom than it is side to side. But you can see just how tough this is. And this is quite normal post-infection. You almost get that surface layer of skin that's been killed off with that infection being in there. And if you look beyond, look at the difference in color of that ear canal wall skin further in, just beyond the suction tube there. You can really see that it's pink, it's aggravated. Eardrum, there we go, we can see the drum now. So patient's going to be hearing well now at this point, or certainly better than they have been, because that main central blockage is gone. But now he's got to tidy up around this outside edge. And then by getting rid of a lot of this infection debris, it means that sometimes GPs will prescribe a spray for an outer ear infection, and that now can actually get in. Imagine that wall you had in there to start with that had hardened up, and that's usually a reaction to that spray going in. It hardens a liquid kind of discharge, and then anything you put on top of that's never getting down to that infected skin further in. It's only just sitting at that surface hardened up section. So he's just peeling this away, and again, look at that long strip of dead skin peeling down. Look at that, peeling down the canal wall. Much healthier looking skin underneath there. Tough old one to do, this one. There is a nice, quick and easy one at the end of this, and that's actually Taylor's as well. I know that one's coming up. But look at this peel go. Wow, see just how tough that skin's gone. There we go, let's peel from the side now. As he was trying to peel that one section, you could see the other section was holding on, but look at that go, look at that. That was a chunky piece of infected skin there that's come away. We can see that section to the top left. I'd be really interested to see, the sort of almost like the post follow-up, if you like, of this one, because this is their first follow-up. So we didn't treat anything the first time around because they came in just feeling blocked and a little bit uncomfortable, which can also be signs and symptoms of wax as well. But in this case, it was this infection. So we needed to get that treated before we could do anything, because we can remove the infected debris. We can suck out that sort of very liquid debris that was in there. Oh, look at that for a peel. But the difficulty, just a little bit of a flinch at the end there, because these ear canals are ultra sensitive with everything going on in there. But if we got rid of that, what would happen is, unless you treat the infection, that infection is just going to come straight back. So you're going to end up with another lot of very liquid discharge in there again. There we go, just peeling around the outside edge. There we go, taking that section away. Oof. Very, very sensitive skin there by the looks of it. You can see how that blood vessels come to the surface there. It's almost like, it looks like, it's not a bleed as such, but it's where you take off. It's a bit like if you've pulled the skin on the side of your nail and you get that kind of red, you can see all the blood vessels really prominently. That's what's going on there. So I think with another course of antibiotic, or certainly with a spray in there, it's going to make that ear canal feel a heck of a lot better. There we go. We're just coming to the end of this video now. I would imagine there's probably not a ruler shot on this one. I doubt there probably would be. But there we go. Eardrum doesn't look particularly healthy, but understandably so with everything that was going on in there. Another one of Taylor's to finish us off in this compilation. Now you can see this really deep wax. Now this is going to go one of two ways. This is actually skin looking at that rather than wax. Oh no, that came away. Oh wow, look at that. That just came away really easily. He lucked out on that one, he really did. So what we can see now is just this last little bit that needs to come away, just at the bottom here. And if it's anything like the top section, it's going to peel away nicely. Yeah, it's been well oiled in there, so you can see all that has come away fantastically well. There you go, little tiny bit at the top there. Is he just going to nip that bit off as well? Oh, a nice, quick and simple one. A lot of tympanosclerosis here, that milky patches on the eardrum on that one. It can happen with age, or scar tissue as well. So just under 1 centimetre. What's that? 1, 2, 3. Just over 3/8 of an inch, maybe 4/8 of an inch, something like that. 4/8 of an inch. What's 4/8? 4/8, quarter. No, 4/8, half. No, I don't know. 3/8 of an inch. I need to put the rulers around the other way. Well, guys, thank you very much for watching our video again today. Don't forget, if you do enjoy the videos, you can always like, heart, share, follow, and subscribe for us. That would be fantastic. If you really, really enjoy the videos, you can also consider becoming members. No pressure from our end, but you can become members to see even more videos if you want to. But as always, guys, take care of yourselves, take care of your ears, and take care of one another. Realistically, it's going to be me for the next couple of days again, guys. Me and Taylor couldn't get a voiceover this week, and he's off this weekend, so we'll probably catch up with him again next week. So I'd say probably from Wednesday onwards next week, you'll have the lovely Mr. Taylor Green back on your screens as well. But until then, see you soon.